Furosemide, commonly known as Lasix, is a diuretic used to treat fluid retention. Nurses should monitor potassium levels closely, as hypokalemia can occur. Assess for signs of dehydration and be cautious of ototoxicity, especially if administered intravenously too quickly. Lisinopril is an ACE inhibitor used to manage hypertension. Nurses should monitor blood pressure regularly and be vigilant for signs of hyperkalemia. It's also important to assess renal function, as lisinopril can affect kidney performance. Metoprolol is a beta blocker that helps manage high blood pressure and heart conditions. Before administration, check the patient's heart rate and blood pressure. If the heart rate is below 60 beats per minute, hold the medication to prevent bradycardia. Digoxin is used to treat heart failure and atrial fibrillation. Nurses should check the apical pulse for a full minute before administration. If the heart rate is below 60 beats per minute, hold the dose. Monitor for signs of digoxin toxicity, such as nausea or visual disturbances. Warfarin is an anticoagulant that requires careful monitoring. Ensure the patient's INR is within the therapeutic range of 2 to 3. Educate patients about the interaction with vitamin K, which can affect warfarin's efficacy. Heparin is an anticoagulant used to prevent blood clots. Monitor the patient's APTT levels to ensure they are within the therapeutic range. Be vigilant for signs of bleeding, and know that protamine sulfate is the antidote for heparin overdose. Regular insulin is used to manage blood glucose levels in diabetic patients. Monitor blood glucose levels closely and watch for signs of hypoglycemia. Rotate injection sites to prevent lipodystrophy and ensure effective absorption. Metformin is an oral diabetes medication that helps control blood sugar levels. Assess renal function before administration, as metformin can affect kidney performance. Hold the medication if the patient is undergoing a contrast dye procedure to prevent lactic acidosis. Potassium chloride is used to treat or prevent low potassium levels. Never administer it as an IV push, as it can cause cardiac arrest. Monitor the patient's cardiac rhythm and serum potassium levels to ensure safety. Levothyroxine is a thyroid hormone replacement used to treat hypothyroidism. Monitor thyroid levels to ensure the dosage is effective. Advise patients to take it on an empty stomach and avoid switching brands, as this can affect absorption. Albuterol is a bronchodilator used to relieve bronchospasm in conditions like asthma. Assess lung sounds before and after administration. Monitor for side effects such as tachycardia and tremors, which are common with albuterol use. Morphine is an opioid analgesic used for severe pain management. Monitor the patient's respiratory rate closely, holding the dose if the rate falls below 12 breaths per minute. Be aware of the risk of hypotension and adjust the dose accordingly. Prednisone is a corticosteroid used to reduce inflammation. Monitor for signs of hyperglycemia and increased infection risk. It's crucial to taper the dose gradually to prevent adrenal insufficiency when discontinuing the medication. Phenytoin is an anticonvulsant used to control seizures. Regularly monitor drug levels to ensure they remain within the therapeutic range. Educate patients about the risk of gingival hyperplasia and the importance of maintaining good dental hygiene. Vancomycin is an antibiotic used to treat serious infections. Monitor trough levels to ensure therapeutic dosing. Be aware of the risk of red man syndrome, which can occur if the infusion is administered too quickly. Nitroglycerin is used to treat angina. Monitor the patient's blood pressure, as hypotension can occur. Educate patients about potential headaches as a side effect, and advise them to store the medication in a dark container to maintain its efficacy. Captopril is an ACE inhibitor used to manage hypertension. Monitor the patient's blood pressure regularly. Be vigilant for side effects such as a persistent cough and angioedema, which may require discontinuation of the medication. Spironolactone is a potassium-sparing diuretic used to treat fluid retention. Monitor the patient for signs of hyperkalemia, as this medication can increase potassium levels. Regular blood tests may be necessary to ensure safety. Ceftriaxone is an antibiotic used to treat bacterial infections. Assess the patient for any penicillin allergies before administration. Monitor for gastrointestinal side effects such as diarrhea, and be aware of the risk of C. difficile infection. Diazepam is a benzodiazepine used for anxiety and muscle spasms. Monitor the patient for signs of respiratory depression, especially in higher doses. Advise against abrupt discontinuation to prevent withdrawal symptoms.